Morphine, part of this is you are going to have to show me how to do dosage calculation if we're going to give morphine, okay? It is easy, guys, because you are going to have your ATI medication administration sheets with you that you have to fill out because you have to be able to provide patient education on medications. You will have that in front of you. Guess what can be on the top? The formula. Like, you guys can just, it's pretty simple. So this, I'm looking, okay, I have 10 milligrams per 1 ml. You're going to have an order in front of you that's going to say, give 2 milligrams, right? Do the math. How many mLs are you going to give?
What was your, say the numbers again.
No, but it's funny because that's often done with this, so please don't do that. Okay. But so if I have 1 ml is 10 milligrams, right? And I need to give 2 milligrams, how many mLs am I going to give? And there's a really nice thing called a piece of paper. So if you need to, you can use a piece of paper. So if you don't have it on your sheet, we will expect you to do it right here on the card. So I've got 10 milligrams, so I'm looking for mLs. 1 ml is 10 milligrams.
They have this on every medical.
Yep, they do.
Oh, wow.
Yes, they have the abilities to do that. So it's, I believe it's 0.5. But can someone just confirm 5 divided by 10 is 0.5, correct?
Yeah.
So I need to give 0.5 mLs. That's a big difference. So I need to give half a ml. So I'm going to use the smallest syringe available to me to give that half ml, right? So I'm going to go in here. I need a... So I have a blunt tip syringe because I need a blunt tip because I need something to be able to get out of my medication bottle. And then I am going to use, let's see here, my smallest syringe possible because I don't want to use a 3 ml if I'm giving 0.5, right? It's easier to measure this way. So I am using a Luer Lock 1 ml syringe. I'm getting some alcohol. I just get extra. Get my piece of gauze here. So when you're doing your CPE for PO, just so you know, you're not going to be required to put like water in it. You would just say like, I would put water in this. I would bring it to the bedside. I would make sure they can swallow, like all of those good things. All right. Mind you guys, these are reusable for us. So when you close these, please make sure you close these whenever it does get full. Don't just try and jam stuff in there. So, all right, I've done my math. I've confirmed my patient is in pain. My order says I need to give morphine 2 milligrams. I did my math, so that's going to be 0.5 mLs. My order says to give the morphine if my patient's pain is 5 or greater. Her pain is a 6. I asked. That's also a part of a question that you have to ask. You have to ask those pertinent questions. Okay? So first thing I'm going to do is I'm going to scrub the top of my bottle. For how long? Does anybody know? 15 to 30 seconds. During your CPE, you're just going to sit there, right? And then I'm going to be like, continue, right? Okay. So this is the key part. These are sterile, right? We want to keep them as sterile as possible. So I am opening up this. I have it like this. See how I'm not touching it? I'm going to go ahead and take this out. And I'm going to attach this. Notice how I did not touch that at all. Okay. All right, so the next thing I'm going to do is I'm going to pull up exactly how many mLs I need to give, and in this case, it's 0.5. So I just pulled up 0.5 mLs of air. Can anybody tell me why we do 0.5 mLs of air? Go ahead.
When you push the air in, it displaces and pulls exactly that amount.
Very good, yes. So it's going to pull out that negative pressure of putting that air in is going to pull out what you need. Does that work all the time? Absolutely not. So just know that, I'll talk about it in just a second, that it's not always going to work. So do I do this? No. So you leave your bottle on your table and then I push. Once I have fully stabilized it in, I'm going to flip it up and I'm going to push. And then you'll see how it, for mine, it did not work. It only brought out a little bit. So this is the key thing. When you're doing this, you want to make sure that I am not touching the plunger. A lot of people want to do this, right? We don't want to do that. You want to just pull from the end and do your best not to touch that plunger. Okay? You'll see air gets caught in it. Do I want any bubbles?
No.
All right. So now I am done. This is one of two only needles you can recap as a blunt fill. You recap by scooping. Do not actually push on there. That is another grounds for failure. So then I'm gonna look and double check another time. I'm double checking my order. It's 0.5 mLs. This is 0.5 mLs. I have no air bubbles in there. There might be one. And so I'm just gonna give it a good tap and it's gone. Now I'm gonna take my sterile alcohol pad. I'm gonna take this and I'm gonna go to the patient's bedside. You are expected to label anything that has some sort of medication in it, okay? So you have this pretty little roll of labels. I will say the ones for like fluids that you're putting in your syringe are a lot smaller in the clinical setting. They're not these giant ones that you normally put on IV bags. So I'm going to label this. It says patient, Kelly Patel. She's in room 201. Drug, morphine, sulfate. And I am using the bottle of medication to write what I do on the label, not my MAR. A lot of people want to look at the MAR and label from the MAR. You label from the bottle you use. So I look, okay, I'm using morphine sulfate, 0.5 mLs / 2 milligrams. No base solution is included in it, added by MB. Today's date, which is the 24th. And it is 8:50. Fantastic. Expiration date is always a year after. So 05/24/24. Then I have this, and I'm gonna label my syringe. So that is accomplished by doing this, because you do not want to cover what you have in there, right? That's gonna completely negate the purpose, especially if it's a narcotic and you have to dual sign off. All right, so the next thing I need to get, and the last thing I need to get, is my needle that I'm going to actually use to go in the patient, because blunt fills do not go in your patient. So I go in here, and I'm using a Medline's Sure Snap safety needle. It's a 25 gauge. That's a pretty normal standard size, okay? I take this to my bedside. I am one of those nurses, I do not attach it at the cart. So I take my gloves off, I do my hand hygiene, and now I'm going to come over to my bedside with my medication, with my alcohol pad, with my little gauze. Okay, beautiful. You would also bring this if you're an RFID scanner, because then you're gonna have to scan it in your RFID thing, but we don't do that here. Alrighty, now I'm at the bedside. I'm here to assess Miss Kelly. Hi, Miss Kelly. I'm here with your morphine because I understand that you're in some pain today. Is your pain still 5 out of 10? Oh, it's 6 out of 10 now. It's gone up. Okay. All right, well, I've got something for you. I do just want to let you know morphine can cause respiratory depression. So if you are feeling short of breath or having any issues with that, please let me know. Your vital signs are within normal limits. Your respirations are above 12, so it's okay that I give this medication to you. Please always call for assistance with this medication. because it can make you a little loopy and feel a little bit dizzy. So you're gonna wanna be able to call so you don't fall. Do you have any questions? No? I'm just gonna verify she's allergic to iodine. This is Miss Kelly Patel. Now I'm looking at my MAR 111026, great. Says order to give 2 milligrams of morphine for pain greater than 5. This is 0.5 mLs or 2 milligrams. Beautiful. So Miss Kelly, I'm going to give this in your thigh. It is going to feel like a little bit of a pinch, but I will be quick for you. I'm gonna get my alcohol swab. Use my hip and my knee, meet in the middle to find my spot. Now, while I let that dry, that's when I'm gonna go ahead and attach this. So I open this up and I do it in the same fashion that I did with the other one, right? I try and not touch it as much as possible. Again, actual sharps, people, so please be careful. So now I have my medication and I'm ready to give it to her. Miss Kelly, I'm gonna go ahead and give this to you. You're gonna feel a quick pinch. I'm going to pull back by doing the Z-track method. Can anybody tell me what that is?
Like when you go in, you start and then it's like a Z, but you enter at a certain angle and then go down and over.
So the Z-track is when you pull the skin back so that when you pull the needle out, your skin falls over it and blocks the hole. That's the Z-track method, okay? So, and people say a Z-track just because like you would move your hand sometimes in a Z to pull the skin, but other than that, we just pull the skin back, okay? So I'm pulling the skin back. Okay, Miss Kelly on 3, 1, 2, 3, beautiful. Okay. All right, Miss Kelly, I am all done. Again, please make sure that you call me if you feel like you're having any respiratory depression. I will be in here in about 30 to 45 minutes to reassess your pain and make